I'd like to move us to our second presenter today, and that is Ms. Lebohang Patricia Mothae, who holds a master's degree in public management. She is the executive director of the Christian Health Association of Lesotho, CHAL, a network of church-owned health facilities that account for 40% of Lesotho's healthcare. She's also the vice chair of the Africa Christian Health Association platform and the Southern Africa representative. She has been involved in academia at the University of the Free State in South Africa and Limpopo University of Technology in Lesotho for about 7 years, where she lectured in the areas of public and municipal administration and management, public policy, public finance management, and human resources management. She is also engaged in research and published in accredited journals, as well as contributed a chapter in a book addressing governance and leadership, public policy and public service delivery, and local governance and development. She also serves as a member in the National Drug Supply Council, the Inter-Country Coordinating Committee overseeing the National Extended Program of Immunization, Solidarmed Lesotho, and National Health Research Ethics Committee. Greetings, Ms. Mothae, and welcome today. Thank you for joining us and being part of this webinar. On to you, Lebo.
Thank you very much, Janelle, and greetings to everybody. As you already mentioned, I'm coming from Lesotho at the Christian Health Association of Lesotho. I will build on what Dr. Mpundo already presented, but zooming in directly into the specifics of Lesotho, the situation of Lesotho, and how that has affected the health systems in general. But again, be a little bit detailed in terms of the medical supplies to see how, as a service provider, we have been dealing with the COVID-19 and the challenges that come up with. I'll also deal with the good practices that we have managed to come up with in order to manage the healthcare delivery, but also on the same time manage to deliver services. A slide, please. Another one. Thank you very much. CHAL is a network of churches-owned health facilities. And as already mentioned, it's a second largest healthcare provider in the country with 40% of care. And most of the facilities of CHAL are located in the rural areas and mountainous areas, whereby the communities therein are mostly vulnerable and underprivileged because they are underserved. And now with COVID-19, we're seeing an increase in unemployment and poverty levels in those areas. Next slide, please. The COVID-19 situation in Lesotho is quite interesting. Up until now, as a country, we are having 2 confirmed cases. We haven't really done a lot of testing, as we have only focused on the suspected cases, not yet done mass testing because of lack of resources. As a result, our testing capacity has been very low. We also managed to train, and we're doing that continuously in collaboration with the Ministry of Health, the healthcare professionals and the community leaders to take part in the response on COVID-19. We have also integrated and guided response that come from the national down to the community levels, wherein the responsibilities of the different bodies are complementary in the response to COVID-19. This includes the National Command Center with the national leadership, and also the facilities that work together at the district level with the district authorities, and the communities as individuals, community leaders, also the community-based organizations, This is where a lot of collaboration is happening for us to manage to do risk communication and case detection. Lesotho is totally landlocked by South Africa, which we now know that is the highest or has the highest confirmed cases in Africa. And there are many Basotho who are working in South Africa who are now returning back. And all of this put a huge pressure on Lesotho, a huge pressure on us as a service provider, but a big risk and a threat in terms of COVID-19. Another slide, please. I will look into the health system and looking at the health system in general as a country, but also bringing it down to CHAL as a service provider. The country already had a shortage of human resources for health, in the sense that we are using more to a large extent imported professionals, and we also have limited skills. Therefore, with that shortage and challenge that already exists, our system becomes a little bit overwhelmed to deal with the needs of COVID-19. This is why at some stage we find that there's got to be a share between the routine services and the COVID-related services. And that means, in a nutshell, the service delivery will be compromised. Health financing. As a country, we've been having a challenging economic and financial environment, whereby we found that our healthcare is very much under-financed. And now with COVID-19, there has to be a diversion of some of those funds, which are already limited, to the COVID-19 response. And because of that, because of the restrictions of movement in the country, which include restriction on economic activities, there's also non-adherence to set restriction for control of COVID-19, because people feel a need that they can stay home hungry, they need to work, they need to continue and find some food. So there is a lot of non-adherence, and that also means an implied possibility of infection. The leadership and governance, as I said before, is from the National Command Center down to the community level. But there has been an experience of a battle between the political and environmental and professional leadership, whereby decisions are centralized. And as a result, there is a delayed communication of such decisions. And in some cases, they become confusing as they are not based on science. The service delivery has been compromised. There has been a lot of sacrifices that were made in order to enable us to respond to COVID-19, especially whereby the community health services were restricted as a measure to control infection, and this had adversely affected accessibility, quality, and continuum of care, which says as we respond to COVID-19, there are other areas of health that are now being neglected. And therefore, as Muffin already mentioned, we are bound to see a number of sick people going high. We're also facing a possibility of emergence of epidemics such as the measles outbreak, because now as another measure to infection control, the already overwhelmed system, it isn't becoming easy to deliver a comprehensive care. And immunization program is one of those that has been adversely affected. And if it continues in this manner, it says sooner or later we will battle with an outbreak, which will also put another pressure on the system. A slide, please. When we come to the medical supplies, this is an area that has been very much compromised, in the sense that while the global restrictions exist and continue, and as a landlocked country that depends mostly to exports, we find ourselves with challenges of depleting stock. At a stage, the essential and vital drugs are still available, but if these lockdowns are extended, then we are facing a threat to getting out of stock of those drugs. We are also experiencing poor quality of medical products. For example, we had to recall the disinfectants that were provided to the facilities because of the poor quality that was realized. Then it says if we are not cautious, we are bound to using low quality products, and that will ultimately affect the quality of care in general. There is also an increasing irrational use of antibiotics and immune boosters. Everybody wants to prevent COVID-19. Everybody doesn't want to be infected, and everybody is taking a precautionary measure. Unfortunately, a precautionary measure that is not based on scientific evidence, and this is also due to the misinformation that we see in different platforms. And because of that, people are using irrationally the antibiotics and immune boosters as a prevention measure. And this is one of the areas whereby we will find ourselves facing a possible AMR. On the same note, we are seeing a scarcity of PPE, which I believe this has been a challenge in many countries. It's a challenge with us in the sense that it isn't available. Even where it is available in the markets, it is with very high prices. But we also, because of those challenges, find ourselves with a challenge of reuse of PPE, because in some cases those are not available, or us using PPE which has lost potency and which also subject us to increased infection. A slide. Because we're already having serious financial challenges as a country and also as an organization, it says it becomes difficult to obtain the PPE that is required in terms of numbers and the quality. While we are trying with different partners that we're working with, but the country in general is facing a scarcity of PPE. There is also a high defaulter rate that is caused by, to a large extent, prohibition of community services, whereby we were in a position to reach those communities that are not able to come to the facilities for various reasons. And in this case, now that community health services are still prohibited, it says those people are not accessing care. That means even those who are supposed to be refilling their trucks, they are not able to doing that, and therefore there is a high defaulter rate. There's also a possibility of a surge of AMR, and Mefin already talked a lot about it, so I will not discuss it further, but this is attributed to a large extent a high defaulter rate, especially for the chronic diseases. A slide. The practices that some of them were already in existence, some of them we had to come up with so that we manage within these trying times, include the national guidelines that we adopted at all levels of the association, from the secretariat down to the facilities, which also helped us and put us in a good position to prepare ourselves to respond accordingly and put us in a better position to mobilize resources. We also have strengthened the multi-month dispensing. We are having migrants who are coming from South Africa, who are still in South Africa, who are now defaulting on their treatment because they are not able to access that. So we have strengthened our multi-month dispensing so that at least the patients remain with a considerable amount of drugs in their hands that they can use throughout this time of restrictions of movement. The community art groups are also strengthened so that we don't get many people coming to the facilities just to refill, but we have at least a designated person who can, on behalf of the group, bring in their refills. The village health worker program is also being strengthened in the sense that in addition to the responsibilities that they have always been doing, they are now trained and capacitated in general to respond to COVID-19 at the community level. And that also strengthens the collaboration of the health facilities with the local authorities and the communities. We have some committees that we had to establish mainly for the COVID-19, the committees that are representatives of a number of segments of the communities, so that each constituency is represented and can contribute to the plans and participate in the general response. There is also an integration of the suspects which were still under observation. And this was because of the stigma and discrimination that was seen to come along with COVID-19, to a point whereby some of the people who were coming from South Africa, community members, wouldn't want to talk to them, wouldn't want to see them because they believe that they're coming with infection. So we are having a program of integration whereby we work with the community leaders to try and integrate the suspects into the community with limited discrimination. A slide. As I conclude this presentation, I want to add that it has been a challenging time for us. It has been a challenging time for the country. There is no doubt it's a challenging time for the region, but importantly for the entire world. And therefore, one cannot overemphasize the importance of partnerships and collaborations in the fight against COVID. We cannot do it alone as an organization. This is why we had to partner with both the private sector in the form of financial institutions and others to assist us in preparing ourselves for the management of COVID. We also had to improve our partnership with government to find ways in which we can collaborate, areas in which we can assist each other in the form of PPE, in the form of capacity building, and in the form of information sharing so that all the parties in the country are in a better position to respond and that we standardize that response. Therefore, collaborations and partnerships across the board are important. There's also a need to protect and sustain the investment that have been made on healthcare. As a country, as a region, we have been fighting against HIV for a very long time. And if now during COVID, we neglect that which we already have been doing, it means that we will be putting those investments at risk. Therefore, it is important that while we fight COVID-19, we also focus on other areas of healthcare. Let the immunization continue. Find ways to deal with other chronic and underlying conditions so that we don't find ourselves in a tricky position as we get to the end of COVID. We need to stay vigilant irrespective of our situation. We're only having 2 cases, but we're always up on our toes. Even those who have already progressed, have managed and have successfully gone through this era of COVID-19, it says, because we don't know what happens tomorrow, and because of this limited evidence on the ground, we need to stay cautious and vigilant of the circumstances around us. Thank you very much, Janelle, and everybody who have been listening. Stay safe.
Thank you so much, Ms. Mothae, Lebo. Again, this is an incredible presentation, and we can't say thank you enough. There's so many points and so many critical areas that you raised, and of course, I think in combination with Dr. Mapundo's presentation, this gives a really good overview, and then sort of a really good deep dive into what we're actually seeing. You know, sort of the impacts upon the continent of Africa, but then also kind of looking in at a country level and seeing some of the actual dynamics and what are some potential possibilities, but also what are the overwhelming challenges that we see today and the challenges we see coming forward. We're going to actually shift right now. And so I just want to say again, a great thank you. Thank you so much, Lebo. This was an incredible presentation. I'm going to have a shift right now to really just having our conversation. And really opening it up to some of the discussion that's been, you know, in the chat room. But also, I certainly have a question and certainly a statement. I think, you know, Global Health Action, we've been really looking at building capacity within community systems and health systems, and also looking at building capacity for those two to connect. I think one of the things that, you know, Dr. Mapundo, you raised was here we've got the international community that, you know, provides a lot of resources to the African continent as it relates to health and development. And they're having conversations, and I can include ourselves in that, but certainly there are lots of conversations happening about, okay, so how do we get supplies not only for us, but also to Africa, because we recognize the sort of limitations that have currently been there, particularly with the health systems strength and sort of the weakened health systems that do exist. And so there's that conversation and several conversations that are happening there. And there's several relationships and collaborations that are forming. But I think you both have brought to the table that that's great and that's happening externally, but this is what we're doing internally. And I think, you know, Lebo, you really kind of shared out, here's what we're actually doing on the ground. Yes, we're receiving, you know, foreign aid, but here's what we're doing to ensure that there's collaboration, connection, and effective, sort of efficient engagement across all sectors. So that we're looking at unlikely partners and bringing them in. And so I would love for both of you, if you can kind of speak a little bit to a couple of things. One of the things that we've been hearing from some of our partners, let's say Kenya, Uganda, has been, you know, for the health facility level, there's an increased fear, right, of going to the health facilities. We see that here in the US as well. And so what that does is certainly that limits, right, the immunizations. That has a direct impact on whether folks are going to have the immunizations for their children. That impacts potentially even mental health of both the healthcare providers and practitioners, as well as folks. But I think when we get down to supply chain, what that potentially does is that impacts the bottom line of the facility and the functioning of them. A lot of times they use the money that they receive from providing services to then procure, you know, PPEs and the like. So what are you seeing as some potential strategies and probably even getting into some details of the innovations that you're actually employing, Lebo, you know, at CHAL, but also Dr. Mapundo, what are you seeing as some opportunities for community-based organizations, grassroots organizations, FBOs that may not necessarily have been officially a part of supporting the health system? What can they do to be a part of this as well? So I kind of have a couple of different questions, a couple of different statements, but I'd love to have you guys sort of just respond to sort of one of the things that we're seeing when it ges all the way down to the ground.
Yeah, but let me. Yeah, I think one of the things that that we see is that, and this is, I think, one of the challenges with African countries and most of the low and middle income countries, because even when really countries, because for example for COVID-19. Even to start at the starting point, as opposed to the West, is different. Yeah, in Africa, your starting point is to say, oh, we don't have even money to convene a meeting to start thinking and planning about the resources that we need. And so you have that meeting, and then you don't know where your funds are going to come from, and so you start planning. And most of the facilities in the low resource actually settings, they don't plan for 2, 3, 4 months. They don't stockpile because like you indicated, they don't have actually enough resources, and so they buy really based on the financial resources that they have, and they may be able to buy maybe for a month, or depending on the terms from the suppliers. Most suppliers may accept, let's say, 30 to 60 days payment plans, and that's why, they can be able to do that. But I think one of the, there are a few things I think that that are problematic or were problematic. Number one is that when we started the lockdown and limiting travel and all that, I'm not sure that we had sufficient information passed on to people in communities to actually understand what that impact was. I'm not sure that we thought through about the impact that, these measures were going to have on routine care, on immunizations, on getting, ARVs. These are things that that were not thought through very well, and that has impacted, these patients from receiving actual routine care. And I think even when, and that's the same actually challenge that they had in India, where, you're looking at the larger population in African countries. We've got about we've got around 80% that are in the informal sector. And those 80%, there is a larger percent, again, from the 80% that work on a daily wage. If they cannot work, then they cannot actually get the money. And so we tell them they can't leave their compounds. And these compounds, some of them, there's no running water. These amenities are actually not even there. And then you tell them, well, you stay there until we don't know when. And actually, when they try to go out, they are arrested or they are beat up by the police. So I think the health system is not cut out, or it's not built to be able to allow that it can respond to a pandemic. At the same time, it can continue providing routine care. And of course, the misinformation now comes in, and all those actually make it difficult to provide actually care. But the faith-based organizations who don't depend on government funding in most countries, then they have been at a loss for this period, because if they cannot see the patients cannot pay. Right. And so, the sources of income generation are actually affected. And so it's a huge problem that I think what actually COVID-19 presents us is an opportunity to rethink how we can actually indeed start thinking about really the health systems actually strengthening, to start thinking how can we be able to support systems that work not just from the top-down approach but the bottom-up approach, to ensure that we are thinking especially of the most actually vulnerable and the most indigent that are going to be affected in this what when I was saying 26 million being pushed into extreme poverty. It should disturb all of us, because that's really scary.
That's unbelievable. Yeah. Thank you so much. Thank you so much, Dr. Mfundo. Ms. Mothae, do you have anything to close us out with? I think we're kind of at the top of our hour, but yes, I'd love to hear from you.
Yes, COVID-19 is very complex and has brought a lot of unpredictability. On a daily basis, as you wake up every morning, there's something new that is going on, whether it is through evidence or not. So it says, as a strategy to survive this period, we need to keep adapting every now and then, be flexible as flexible as we possibly can, and acknowledge a number of factors that are affecting COVID-19 so that we will have a much more integrated approach as we respond. But as I said again, the response cannot depend just on government.
Right.
Or CHAL as a service provider. We need all the hands on the deck.
Mm-hmm.
In order for us, or what enabled us as CHAL to have managed to this end is because of the number of partnerships that we are having. We are one of the very few in the region who have a partnership that is financed comprehensively by government. A partnership that has underlying principle of standardization, so that both the resources in CHAL and in government are in almost the same level and in same form, so that we respond in a standard way to the communities. But I must also admit that without that support of government as a partner, it makes service delivery systems very weak for any FBO organization. It also makes it difficult in this time to respond and manage on a daily basis. Therefore, one of the strategies that I think as FBO specifically we need to focus on and strengthen a lot on is to keep going with the resources mobilization, partnerships and collaboration. It is now time to strategically choose those stakeholders that we have a common interest. And now I believe there's a number of those because COVID-19 has become a common interest to everybody. As it is now, we have managed to work with institutions that we never thought would really be interested in providing any form of support. We've worked with the Standard Bank Lesotho, which has helped us with the ICUs so that we can complement the government in the management of cases. We have worked with a number of private organizations such as Metropolitan Lesotho and a US-based foundation, Brothers, to acquire a lot of PPE so that the health professionals can not only be protected, but they are in a position to continue with the care of others. Another critical area that I think we need to work on strongly is some upliftment of these health professionals. They are the ones who are now the warriors who are protecting all of us, but it doesn't mean that they are immune from the virus. And they have taken a lot of risks, in some cases with nothing at their hands to protect themselves. So there's a need for us to find a way to keep empowering them, capacitating them, and uplifting them just by acknowledging the work that they're doing and appreciating their efforts in protecting the nations. So in general, Janelle and everybody, all that we need to do is to work together, think together, map a way forward together, find ways and means to sustain together. Thank you.
Thank you. Thank you so much, Lebo. Thank you so much, Dr. Mfundo. I think we have so many questions on the chat room and our time has definitely run out, but I think there are a couple of key things that we can say. One, this is actually the beginning, I believe, of several conversations. And one of the things that we want you to know as GHA is that we're actually going to invite folks to join us. This is our last sort of webinar in this fashion, but we're about to sort of launch some strategy meetings with sort of unlikely partners. I think as you shared, Lebo, one of the things that we recognize is something that has been unused or untapped enough has been the sort of lack of effective partnerships with or without dollars, right? And so how are folks truly doing stakeholder mapping and the like? And so we would love to invite everyone on this call and any of your connections and colleagues to join us when we do send out that invitation. We do hope that it'll be sort of on Fridays, it'll probably be a little earlier in the day, but we will continue on these conversations. There's several questions and comments on the chat room. There's several questions and comments in our past chat rooms. We're actually pulling together those questions and plan to actually have some response to those inquiries and to those comments as well. Thank you all so much. I think one of the things that we recognize is there is a power of community, and everyone has a part to play in this fight, and recognizing that we're not only dealing with the emergency of today, but we're also needing to look at what are the emergencies that are to come. As this kind of unfolds. So Dr. Mapundo, thank you so much for your time. Thank you so much for the richness of your presentation. Ms. Mothae, thank you so much for this presentation and just sharing what's going on the ground and giving folks, I think, something to think about in terms of how we engage moving forward. Thank you once again. And without much ado, I think we're going to close out our webinar. Please continue the conversations on our social media, on our website. We will continue to respond and look to hear from us soon. Thank you, everyone, and have a great rest of the day and a great weekend. Thank you so much.
Thank you very much.
Thank you, Janelle.
Thank you.
Thank you. Thank you.